Good afternoon, everybody. This is Dr. Mahmoud from North Carolina A&T State University, and I'll be with you presenting this paper, Google Search and COVID-19 Cases in Saudi Arabia, a correlation study. So this is the list of authors helped me in this paper, and this is my agenda for today. I'll start with introduction, then methods, results and discussion, conclusion, and future work at the end. So first, we start with what is coronavirus. All of us know coronavirus. It is a fever virus started in 2019 in China, then has continuously and gradually spread in several countries and became a global pandemic in March 2020. Schools are closed, airports are closed, many industries and operations are affected. And now recent attempts have exploited the information in Google Trends to better monitor the recent COVID-19 outbreak. So the idea is to see the trends in Google, like people searching for expressions like fever, cough, and many other keywords related to COVID-19, and see how this is correlated or uncorrelated with the reported cases in Saudi Arabia. As a related work, Walker et al. Demonstrated a strong correlation between the Google search related to smell information and COVID-19 cases in Italy, Spain, United Kingdom, USA, Germany, France, Iran, and Netherlands. Also, another study examined Google search keywords for wash hands and face mask correlation with number of confirmed cases among 21 countries. So what this study is aiming to, we are aiming to validate utilizing Google Trends data as a complement data source for digital surveillance in Saudi Arabia. We investigate the correlation between Google Trends data collected from the publicly available data on Google and the reported cases by the Ministry of Health in Saudi Arabia. So what are our methods? So first, we started to collect Google Trends data from March 2nd to October 31st, 2020. Data of daily COVID cases also in Saudi Arabia were collected by the Ministry of Health daily report. We collected this data also, and we obtained the symptoms, from Google Search Trends using Google Trends, an open access platform that provide the relative search volume for any keywords that you would like. And the daily trend data associated with the list of Arabic keywords obtained from Google Trends are obtained by setting the location parameter to Saudi Arabia and the time parameter to March to October 2020. This is how we collected our data. We tested the correlation of each 29 symptoms keyword and the overall number for each relative search volume symptom. And the total number of relative search volume for each symptom is shown below. So these are the keywords investigated in our study: fever, cough, sore throat, shortness of breath, headache, runny nose, loss of taste, loss of smell, and diarrhea, and fatigue. And this is the relative search volume, how many Google search for this keyword have been occurred. And we used Spearman rank. It is a non-parametric measure of rank correlation. It shows a statistical dependence between the ranking of two variables. So the first variable is our relative search volume from Google Trend, and our second ranking comes from the Ministry of Health reported cases. Okay, so we used this rank to show the correlation between the two. Is it a positive correlation, negative correlation, no correlation, and so on. So these are the list of keywords we used: fever, and the synonyms of fever in Arabic. So if some of you are familiar with Arabic, will be able to understand this list of synonyms: cough, fatigue, sore throat, shortness of breath, headache, anosmia, loss of taste, diarrhea, running nose. Okay. So for our results, as you can see here, we tried to visualize the correlation between the number of reported cases in red. As you can see here, this is the number of reported cases in red in the period from March here till October. Okay, so as you can see, the number of reported cases in red increase here till the peak and decrease, and this red curve is the same on all of these figures. Okay, for each one of this figure, this is the Google Trends in the background in blue, as you can see. For fever, for example, as you can see, there is a slight correlation between fever and the reported cases. For example, here, maybe the correlation is much better between fatigue and the reported cases. Here, maybe we can see some correlation. Here, the correlation is much better. The shortness of breath is very correlated with the number of cases reported by the Ministry of Health. And for other symptoms, as you can see here, the loss of smell is very correlated with the number of reported cases. Here also, we can see the correlation. And this figure actually aggregate all of the symptoms, as you can see in blue, with the number of, and compare it with the number of reported cases by the Ministry of Health. As shown, the correlation is the Spearman rank correlation is very obvious here, as you can see, and this is validate our study. So as a conclusion, the correlation found in our study demonstrate the utility of utilizing Google search in providing helpful data to be used in syndromic surveillance during an emerging pandemic such as COVID-19. Our study also demonstrates the potential role of using the internet search in the fight against the current pandemic. Also, it can be used as credibility measure for the number of reported cases, so that we can verify the data provided by the government organization like the Ministry of Health is credible or not. And for here, we conclude our presentation. Thank you. And if you have any question, you can reach any of the author through the email. Thank you and have a nice day. Bye-bye.